Entering genetic test results on version 3 of HughesRiskApps. We can see in this family that the patient herself does not have cancer, and therefore we have opted to test a relative first. When the patient returns to let you know that her father has undergone testing, you can click on the father, and when you click on the father, you can see that he's had breast cancer at 56. When we change that to the genetic testing tab, we can hit a new genetic test and then decide which panel was done on the father and what the result was of that panel. Now, if you notice here, the panels we are choosing are for a breast ovarian type of genetic testing. But if you were in a colon clinic, you could click on colon, and now you would see the panels appropriate to colon. Or if you were in a cardiac genetics program, you can click on cardiac, and this will bring up the panels appropriate to hereditary cardiomyopathies. But in this clinic, we're doing a breast ovarian cancer clinic, so we'll click breast ovarian. We will pick that her father had BRCA1 and 2 sequencing with 5-site rearrangement, that her father did indeed have a mutation in BRCA2, and as you start to type in the mutation, it will bring up mutations present in our database. Our current database of mutations is not completely up to date because there is no easy way to access these mutations over the past 2 to 3 years. However, you can type in your own mutation if it does not appear in our database. You can also then say that the BRCA1 test was negative, and now we see that the family has this mutation in BRCA2 and that the father has tested positive. To see that more clearly, I'm going to make this pedigree a little bit bigger and move the legend out of the way, the title out of the way. And now we want to come back and test our patient. So when we click on our patient and add genetic test as well, we certainly do not want to do sequencing again. So for her, the panel will be a familial known mutation test. It tells you you'll be testing for BRCA2 and the specific mutation in BRCA2, and we can say for that mutation that it was not found. And we now see that that is represented by a minus sign for this individual.